Good afternoon, everyone, or it might just still be good morning. I believe that everyone who has signed up for this webinar is on. So what I'm going to do, I'm in your questions. Please could you just type and let me know that you can hear me and see me. So if even just one of you can do that in your questions, I would be very grateful. Thank you. Excellent. Thank you so much. Terrific. So welcome to the non-clinical peer assessment webinar. Why are you here? You are here for one of two reasons. One, you've been randomly selected to participate in peer assessment, and the process for random selection is a system that is developed and governed by our director of IT. We as staff have absolutely no involvement with the random selection of members to participate. So you're either here through random selection or through the system of currency. That is for a variety of reasons. It could be extended mat leave, it could be medical leave, just a leave of absence just because you are out of the country or something, and you stayed a general member and you don't meet the currency requirements of 750 direct or related hours over a 3-year period. So to ensure the public knows that you are current, you participate in the peer assessment process. So that is why you're joining me here today. So let's move on to what we recommend, and that is that you complete your non-clinical SAT and submit it to CASLPO sort of as soon as possible, because then you've got one step of the process over with and you can relax. Now you can go back onto your SAT anytime and you can access it anytime from throughout the year, and you don't have to resubmit. You don't have to resubmit any question, any, you know, after you've submitted your evidence, etc. Okay, so let us now talk about evidence, because I know this is particularly important for people participating in the non-clinical, because for some of the indicators it is a little more tricky. So I'm going to actually go to my SAT because I am also a non-clinical member. So let's go into the professional standards. And don't forget, guys, just ask me a question at any time and I can just answer them. Yes, so ask me a question, just type it in to the question box and I will answer you. So let us start off with these standards and what you will be submitting as evidence. Now, as you know, we are not requiring you to submit your evidence until after the first week in March. So I think for us, it's March the 6th this year. Okay, now what has proven to be a good way of doing it is, but you don't have to, you can do it absolutely your own way, is gathering all the evidence and maybe putting it into a folder on your laptop or your desktop. And then when you feel as though you've got all the evidence, uploading for each of the indicators. Now, I know that you're non-clinical. but there might be an incident, some evidence where you will be using some patient information. Okay, it's rare, but it might happen. If you are doing that, you should know you don't have to redact the patient's name, and you certainly don't have to get consent from the patient. Okay, I know probably someone else is seeing, another SLP or audiologist is seeing that patient. So you don't have to redact. Why not? Because legislation allows for information to be disclosed to the college for college purposes. So that there is something about it in the Regulated Health Professions Act and in PHIPA. So let us go to a document that we have developed if anyone should be asking about this process, anyone either you report to or your health records. So as you know, when you're going on for this purpose, you click on registrants, and here is the quality assurance program. So you click on that, and here is the peer assessment program. And we have the non-clinical peer assessment guide for you here. I think it'll be a good tool for you. And then we also have information for employers. So I'm going to click on that. Now you can either download it, print it, or send a link to anyone who wants a bit more information on this process in your employment situation. So if you scroll to the bottom, you will see legislative authority for peer assessment and consent and confidentiality. Okay, so there is the information for you, and excellent. So when we're looking at the examples, I mean, you're going to be uploading examples to show the peer assessor that you meet the standards. Now, not all indicators will apply to you. We do appreciate that, but I think you'll be surprised at how many actually do apply. And sometimes you have to think creatively. And we have had situations where in the past where non-clinical members have said this doesn't apply, etc. And then when they've had the interview with the peer assessor, they've learned that it does apply, and they've learned that there is information there to act as evidence. Okay. Now, so let's have a look here. I develop and implement policies that reflect organizational or agency criteria to begin and end intervention that are in compliance with legislation, regulation, and standards of practice. So we'll open that up. And if you have any referral or discharge criteria policies, for those of you in research, maybe some policies or information on participant that are participants that are going to be in your research, maybe. Any funding criteria, agencies, policies, course schedules for SLP or audiology issues if you're working in a university, priority matrix, etc. Study outlines if you're academic, communications with members regarding beginning or ending intervention. So you've got quite a few examples there. And we can go through any of the standards you like and talk about possible evidence for you to upload. So let's say that you have got a discharge criteria policy for the organization where you work. You're not seeing any patients, but you are supervising some patients, supervising some SLPs or audiologists. So this is how you upload the documents, okay? You just click on here and press browse. And here you will see I have some CVs, so of my own. So I'm going to click on this and then upload the file, and there you will see it. Okay, so you can open it and check it that all is good. I'm going to open my CV, and there it is. Okay, but I see, whoops, it was developed in September 2015. I think I've got a later one than that. And so the reason I'm bringing this up is if after a while you think, you know, I uploaded a piece of evidence, but I think something else would be a better piece of evidence, then you can simply delete this and upload something different, okay? Again, to emphasize, you don't have to let us know. And you can do this up until, I would say, a month before your peer assessment interview, okay? So I am simply going to press on this delete button. Are you sure you want to delete this file? Okay. And now I am going to upload through browsing my most recent CV, and there it is, 2019. Okay, now how are you getting these documents onto or into the folder on your laptop, on your desktop, or indeed just coming straight up to your SAT? There are a number of ways that you can do it. Now, we did send you a document, but it is also here how to submit your evidence to your SAT. So if I click on that, it shows you exactly what we have just done now, but also it gives you some advice of converting evidence into a computer file. So you can scan documents, you can use a screenshot. If you have something on file, you can screenshot it and then upload it. You can use a digital camera, you know, a camera on your phone or what have you. If you're doing that, you can either just email the photograph to you, or you can convert it into a PDF by downloading a PDF app if you want. Don't forget, after you have sent it, please delete it from your camera. So also there is something called the snip tool, and you could put that onto your laptop or desktop, and that allows you to snip and develop a file to show your evidence as well. Okay, so I think that's all I wanted to say about how to do that. Now, do go in and check, because one time someone had uploaded everything upside down. So, you know, that just makes life a little bit difficult for the peer assessor. So do go in and just check that everything was uploaded correctly. If you're uploading a form, so let's go to number 3, and this is patient-centered practice. And maybe you are uploading something about consent. Maybe you're doing some research with human participants. They meet your criteria, you're going to get consent. maybe you are working for an audiology hearing aid company and someone wants you to troubleshoot with a patient, and you're going to ask the audiologist who's contacting you, did you get consent? Okay, it is up to them to get consent, but you do want to know that consent was sought and obtained. Okay, so here we have the consent. Now, you might be uploading a form. You might have a form for participation in research. You might have a form that those people who report to you use. If you do, don't upload a blank form. Upload a form that has been used, if you've got one. If you don't have a form that's been used, fair enough. But if you can, upload a completed form. Okay, because that shows, you know, that you are aware of how to use that form correctly. Now, some people have asked, can I use the same piece of evidence for more than one indicator? And the answer is yes. So let's have a look at 3.1. I take reasonable efforts to ensure the organised agency are knowledgeable about obtaining and documenting consent for all intervention and courses of action. And then 3.2, I take reasonable efforts to ensure that I and the organisation are knowledgeable about obtaining and documenting consent to collect, use and retain and disclose personal health information. Okay. So it could be that you have a piece of evidence that will be excellent for both indicators. That is fine. But what we suggest is that you upload to both those indicators. Okay. So you will see, even though it's the same, it's there for 3.1 and there for 3.2. Now, supposing you feel as though I don't have evidence, but I do meet the standard. In that case, write a fulsome description. So let's go back to the audiologist who works for a hearing aid company. Now, they are just maybe ensuring when an audiologist contacts them and says, can you speak with me and the patient directly about the new hearing aid, there is some facet of it that is a bit problematical. And maybe the patient is in the office with the audiologist when they call you. So you would just say to the audiologist, do you have consent? Yes, I do. Excellent. So here you would just write in the comments box that, that you always ask the audiologist if they have obtained consent for you to, you know, review personal health information and or to provide intervention with the patient. Now, you don't have to get consent yourself. It's the audiologist who has to get consent, but you can write your process, what you normally do, in the comments section. Okay, so I am going to see if there are any more questions. Let's see here. Do you have any questions? For some reason, I can't see any questions. If you do, it will alert me, and the questions, here we are. Okay, so hopefully you can hear me. I'm going to check my audio. Yes, the microphone is working. So if your audio is going a little bit in and out, what I would do is come out and go back in or refresh. Okay, so we're now going to look over here for professional accountability, and please feel free to ask a question at any time. Now, we want you to be uploading your professional liability insurance. Every general member has to have it, regardless of what they are doing. So we're going to be asking you to upload it to 5.1. Okay, it's here and you would just upload it. All right. Now, I will be sending out a letter that we are developing for management, because some of you might be working in a place where the administration or human resources purchases professional liability insurance for all staff. So we will be sending you the information of what we require. Okay, excellent. All right, so let's stay on professional accountability, and I am going to go down to our required document that we need you to read, and you will be actually discussing this in your virtual interview. So it is for conflict of interest, so you can just click on it and it will go to the actual document. There it is. And if you could read it and be prepared to discuss it at your interview. Okay. I am now going to go back here, and we are going to go to the practice description, because we're going to be talking about the jobs, the tasks that you have to do before your virtual interview. So this will be preparation. So here, if you can complete this, and then this is especially important, your registration number, phone number, email address, and which part of the year you would like your peer assessment to virtual interview to take place. Now, you have check marked these. I have put here other for regulation. I also do management, research, etc. But as you are being peer assessed, I have put none as additional information. I would add some information here. It really will help the peer assessor, and it will help the you know, the whole process of the virtual interview. So I would just put a little bit more detail of your roles and responsibilities there. Now, we're going to talk now about the matching, the peer assessment matching process. Now, we have about 5 peer assessors who have a non-clinical facet to their role. We have someone who works at a university on faculty. We have someone who is in policy. We have people who are in administration, who have done research, and who have worked for hearing aid companies and in human resources. So I think we're fairly well covered. It will be these non-clinical peer assessors who will be matched with you. So what we do is we call in all of the peer assessors every year for 2-day training. We update them on all different aspects of regulation, of peer assessment, maybe interview techniques, virtual interview techniques, etc., because it's quite different. So they come in for 2 days every year. So you can really rely on the knowledge and skill and currency and competency of your peer assessor. So we will have all of the non-clinical peer assessments put up on a wall along with the other clinical peer assessments. And the non-clinical peer assessors will look at the names and first of all will decide if they're in a conflict of interest. And if they are, they have a sticker saying, "Do not match me." If they feel that they are not in a conflict of interest, that they don't know you, they will put a sticker on to say that they could possibly be considered as your peer assessor. The day afterwards, or actually that happens on a Friday, so the Monday afterwards, Julie, who supports quality assurance program, she's the assistant, she and I go through and do the second phase of matching. So we will look obviously at the roles and responsibilities and match that to the non-clinical peer assessor roles and responsibilities. We will then match according to location and language. We do have French-speaking peer assessors and French-speaking non-clinical peer assessors. So we will match according to location and language. Now, it might be your peer assessor is going to be traveling, but if we can reduce the travel costs, we do reimburse them, so much the better. Okay, so then when we've done that matching, we will send you the name of your non-clinical peer assessor. Now, I want you to know that you have the opportunity to veto the peer assessor. You might know them from a previous position, job. Someone else might know them and say, "I don't think that that would be a good match." It doesn't matter, and we don't have to know. You can just say, "Alex, please select another peer assessor." I'm just going to have a quick drink. Okay, sorry about that. So just let us know. You're given a week. Now, I want you to know that the peer assessors are never informed that you have vetoed them. And we will send you the name of a second peer assessor. That peer assessor will not be informed that they are the second choice, so to speak. Okay, so then you will have, the match will be completed, and you, the peer assessor will be in contact with you regarding setting up a site visit. Now, if you, let's look here, if you select November, December, it might be totally impractical in April to set up a visit in November or December. You might want to make a date, but you might want to say, "Look, can we set it up nearer the time?" That is fine. The peer assessor will just inform us that it will be happening in November, December, and then nearer the time when you've decided on a date, they will let us know for the virtual interview. Now, we do know that life happens and that you might have to change the date. That is absolutely fine. The peer assessor will inform us of the change of date. And it really doesn't matter to us when it happens, as long as it does happen. Okay, right. So for the virtual interview, you need to really think about putting 2 hours aside. It might be shorter. It hasn't, I don't think it's been longer than 2 hours. We've done now about 20 non-clinical peer assessments. So I would be thinking of putting 2 hours to one side. Now, you will be using the college webinar system, and we will be sending you information and the peer assessor information on how to access the webinar. We would really like you to use the webinar, and I'll tell you why. You can share your screen with the peer assessor, and you can pull up documents, you can go onto the website, or the peer assessor can go onto the website, etc. And you can look at documents together in real time. And I think that that is very beneficial. Okay. So let's think about some more preparation for you for your virtual interview. Let's go back to the professional standards and number 5. As you know, you will be discussing about the conflict of interest standards and how they relate to you. You will then be selecting 2 other documents to discuss in the virtual interview. Maybe it's standards or a position statement or a practice guideline, whichever, okay? Let the non-clinical peer assessor know what documents you have selected, the 2 documents, so they have an opportunity to review them as well before the interview. Okay, so you've done that, you've selected, you've gone through all of your evidence, you've uploaded it. If you haven't got evidence, you've added comments. If something is truly not applicable, then that's fine. Okay, so let's have a look at one. I develop and or implement the documentation and processes for the delegation of controlled acts and medical directives. In research, you might not be doing it. If you work in a hearing aid company, you might not be doing it, okay? So that is certainly one that you would put down as not applicable, okay? So you've gone through your evidence, so it's all fresh in your mind. And you've got your 3 documents prepared. So now you will go on to your learning goals. Now I have up here, because I've actually submitted my learning goals, so they will be going through your learning goals with you, you know, to find out about, you know, why you chose it, etc. Let's go, this is one learning goal I am very keen to pursue. So for me to learn more about social media platforms, to improve my knowledge and how it relates to regulation. This is something I really need to do. So, you know, the peer assessor might say, oh, that's a really interesting goal. Why do you feel the need to do it? And then I can explain that, you know, a lot of people now are using social media platforms for advertising, for education, for information to the public. You know, we've got to make sure it complies with the standards, with regulations, etc. So the only way I can do that is be much more informed about social media platforms. Okay, now another piece of advice, between now, probably the earliest you will do your virtual interview is May. So, but between now and May, hopefully you've had an opportunity to pursue some learning. So even though you don't technically have to have your 15 Clacks documented until December the 31st, 2020, I definitely would add your Clacks, okay? Anything that you have obtained this year so far. And, you know, there will be a good discussion about your Clacks, okay? And if you have got a Clack, do add progress to meeting your goal. You know, maybe it's minimal progress, and then the impact on your practice could be actually it hasn't had an impact, or oh, you know, it had a significant impact, whatever. Okay, now the other thing that will happen is they will also look at your 2019 goals and Clacks. Okay, so let's have a look at my Clacks. Have I got any here? No, that was not a good example. Let's see if we can go back. I'm just going to minimize this a second. Okay, so I've got 8 hours here. All right, okay, that's not a good example. So they might be going through your Clacks as well to have a discussion and to make sure that you do have your 15 hours of Clacks for 2019. Okay, so I think we have done everything to prepare for your interview. Okay, now don't forget, all of this information is in the non-clinical peer assessment guide for you. Okay, so do delve into this. We've got a lot of support. And what I am going to do now is actually go to the peer assessment reports. Okay, all right. Now, are there any questions about the process so far? Are there any questions about uploading evidence, about the virtual interview, about your preparation for the virtual interview, about what happens in the virtual interview? Okay, I'm hearing none. So after the virtual interview, one of 3 things is going to happen. Okay, one is that the peer assessor will be saying, I am going to be writing a summary report. Now, this is a very short report, and you might be thinking, oh my God, I did all of that work, and this is all that I'm getting, this short report saying that you meet the standards and that your learning goals meet the criteria. Is that it? I did so much work. Now, the reason why it is very concise is to promote reliability between non-clinical peer assessors. If you have one peer assessor who's extremely verbose and another person who says, yes, they met the standards, what will the quality assurance do with that information? One of the peer assessors could have said that, you know, this was an exemplary non-clinical registrant, and the other person might say, oh, they met the standards. Well, does that mean someone who's met the standards is lesser somehow than the person, you know, who is exemplary? So it is a very brief report. Don't worry, there will be a letter coming that expands a little bit more. Okay, so you've got that summary. It might be that one of the standards that through a conversation that a standard does apply to you, but you don't have the information to hand to show that you do meet the standard. So the peer assessor might have a good discussion with you. We call that on-site remediation, and say, look, I'll give you a week, go and look in your documents, find the evidence and upload it, and then I will say that you meet the standards. If that happens, it's called on-site remediation. You will discuss the on-site remediation plan with the peer assessor. As I said, they'll give you a week, maybe 2 weeks to find the evidence, to upload it, to show that you do indeed actually meet the standard. Then the peer assessor will again write a summary. The Quality Assurance Committee do not know that on-site remediation happened specifically with you. they will be given just aggregate data at the end of the year. Okay, there is a third option, and that might be that the peer assessor says that you do not meet the standards on 2 or 3 of the indicators, and that information will be going to the Quality Assurance Committee. Now, what might happen is included here in the Quality Assurance Committee and the results. They might be asking you to provide more evidence, or they might be asking you to do an education or remediation program. Okay, now you will see these reports, either the summary or the report saying that you do not meet the standards. You will see them before the Quality Assurance Committee sees them. And you are given an opportunity to provide a response to the report for the committee to review. Now, here I would like to emphasize that the whole process of peer assessment is actually confidential. The Quality Assurance Committee will only see information that pertains to you via a number. So we have a number code. It's PA for peer assessment. And then from 1 to 65, because we have 65 people completing it, so maybe you're 32, and then 20 to show the year you were selected. So PA 3220. If you provide us with a response, I will redact it. We've got the software to black out information that might give a hint to a member of the Quality Assurance Committee that they might be able to identify who it is. Okay, so it is a totally anonymous situation. Now, if you happen to know a member of the QA committee, please let us know, and we will make sure that they remove themselves from the meeting when your peer assessment is being reviewed. Okay, we very much are cognizant of conflict of interest. Okay, so after the reports have been reviewed by the Quality Assurance Committee, they will pass a motion saying that you have the required knowledge, skill and judgment and have met every component of the program. And then we will send you a letter. And the letter will acknowledge, it will congratulate you, of course, and it will acknowledge the work you have put into this process and the commitment that you have shown to quality service in the field of audiology or in the field of speech language pathology. Okay, so you will then receive the letter, and then you will be out of the selection pool for 10 years. All right, so I think I've looked at it, at my cheat sheet, and we have come to the end of the information that I wanted to share with you. I am here. We've got another 20 minutes. We can end this early if you wish, but I am here to answer any questions that you might have about the process. Okay, so I'll see, let's see again if there are any questions. Okay, I see that, all right. Okay. Right. I'm just seeing, right, I have just changed from management to a full-time student. How do I provide evidence when in a brand new setting? Okay, very good question. If you feel as though you would like a little bit more time in your new setting, okay, that is more than reasonable. So what we can do is defer your time to upload your evidence. So if that is the case, please could you just email me and say, so we've got it on record, please defer my uploading of evidence. And what I suggest is that you select a peer assessment in either September, October, or November, December, and maybe we'll defer your requirement to upload your evidence to maybe August or something like that. That should give you 7 months to get into your position and to really contemplate. So if you would like to avail yourself of that, please email and we will make that happen. And then, as you know, you can just concentrate on your new position as a PhD student and you know, think about what evidence going on, and then maybe October, November, or you know, September, you can upload the evidence. All right, so I'm very happy to do that. When we have gone in and completed the SAT prior to speaking to you or listening to the webinar, and now we need to go back and change part of the SAT, absolutely do that. It doesn't, okay, you submit it, and that is the evidence that we can provide to the ministry and to the public that you participated in the self-assessment tool process. You can go back on now, as I have just done, and make changes. If you've put some evidence in, you can add it. You can, you know, you only need to put in 1 to 2 pieces of evidence for each of the standards. As I said, you can change evidence, you can do what you like, and you don't have to resubmit. You have completed the requirement of submitting your SAT, so we know it's been done. Now you can go back on as many times as you like. You can change responses. You can change information in the comments box. You can upload, delete, upload more information, okay? So absolutely do that and feel free to do it. We very much want the SAT to be a dynamic tool for all of our members, you know, all the time. We don't want it just to be the thing we have to do in January. Okay, so good questions. Are there any more questions? I see one of you had a problem, but I hope that problem has been resolved. If there are no more questions, we can bring this to a close. Hopefully another purpose of the webinar is to break down barriers. You've now heard me, you've seen me, you know me. Please feel free to contact me or Sarah Chapman-Jay, who is the advisor to quality assurance as well as speech language pathology practice. Now, how do you contact us? Let's go here. I'm just going to do that. So can you see here, practice advice? Just click on that. And here is the team. So if you're an audiologist, you might want to talk to Samida. If you are French, you might want to talk with David, actually, or Samida. She's both French and English. Always feel free to contact me and also contact Sarah. Sarah is a peer assessor herself for non-clinical and clinical, as well as being the advisor to the quality assurance program. Okay, so that's how you contact us. And I'm just going to one last time see if there are any more questions. No. Excellent. So I'm going to say thank you very much for joining us. I really hope that this helped. I have recorded it. I will be sending you the session. So the person who might have missed a little because I believe their sound went, you will have the recording. So I am going to say goodbye from CASLPO. I'm going to go up to the file and I am now going to leave the webinar.